Welcome back to KTN News Center. Now, fears of malaria outbreak has hit Elgeyo Marakwet County following reports that 4 people had lost their lives in the Kerio Valley Triangle. 2 weeks ago, a Form 1 student died and several others hospitalized. Elvis Kosgei now joins us live. Elvis Kosgei, good morning. You're talking about Elgeyo Marakwet being hit by malaria outbreak. Probably talk to us about the areas that have been affected mostly in terms of the constituencies.
Thank you very much, Brenda. In terms of constituencies, we have Marakwet East and Marakwet West. Now, according to county officials, this has been occasioned by early January rains. Remember, there have been stagnant waters in that part of Elgeyo Marakwet County, but as the county government of Elgeyo Marakwet already have issued directive to school administrators, maybe to enable students to seek treatment whenever they display early malaria symptoms. Joining me is Wesley Rotich, the Deputy Governor of Elgeyo Marakwet County. Thank you very much. Maybe what is the situation so far on the ground?
Thank you, Elvis. First and foremost, I want to say that the situation currently is very stable. We have done a lot of interventions and responses, emergency responses across the county. It is not only Marakwet East and Marakwet West, it's the entire Kerio Valley, which runs from Keio South all the way to Marakwet East. We also have issues, we also have cases in the highlands. Probably people who have migrated, or we don't understand how, but I think we have cases even in the highlands, and we have not taken that to chance. We have ensured that all our facilities have enough drugs, which I think EMSA supplied to us recently. We have also placed another order because these drugs get depleted very quickly. Our CEC and even our governor, who was in Nairobi, has already talked to the ministry, and over the weekend we have received residual spraying drugs that we actually, chemicals that we want to spray institutions and even households. And we have engaged all our community health volunteers from Friday last week, and they're already doing spraying of schools, and from today they will start spraying households. Again, we want to say that we want to appreciate the role played by our staff, our medical staff at the county. We recalled some of them who were on leave. And you know, leave is actually a rightful entitlement for our staff, but they heeded our call to actually resume work. And as we speak, we have not received any other fatalities or deaths from the time that we ensured that they are back and when we had all the drugs.
Okay, we've heard that 4 people have lost their lives. Maybe do we know which areas?
Yes, we want to first of all send our condolences to the families that who lost their loved ones. We are really sorry for what happened, but I think it is because malaria is a very serious disease. If you don't take the patient very early for medication, it is a serious disease. So we want to say pole to all the families, and want to say that we only had 4. We have 4 people who died. One being our student, our beloved student from Singora Girls, and then a patient, some 2 patients in a row. One child who is 2.5, and an old man who was already who was a cancer patient. So those are some of the, but immediately after we responded last week, because we had delays in KEMSA when they were supplying drugs, immediately we got all the drugs, and the spraying is ongoing, the preventive measures are ongoing. There is no death that has been reported so far. So we want to say pole to those ones. It was unfortunate, but again, the strategies that we have put in place, led by our CEC and all of us, we have a team now surveilling Kerio Valley, and even myself, I will be joining them immediately after this, so that we see the situation as it is, especially the spraying, and again the drugs, how they are, and even to interact the community to know how they are continuing. We have also requested the communities that, if possible, all stagnant waters, they should report to our community health volunteers, who are doing a fantastic job on the ground, so that we can be able to spray and even to pour oil to some of them, which we cannot. Special thanks also goes to the national government. We have received some few nets. As I told you, at the county level, we give nets mandatory to children under 5 and pregnant mothers. But again, we have received over 5,000 nets over the weekend, and we are distributing from today. But we want to start with institutions, because institutions are crowded areas. We have our children there. We want to start with them because we have so many students in one area. So we want to start that one by giving out to schools and institutions, both primary and secondary, so that we can be able to at least curb this menace.
Thank you very much. That was Wesley Rotich, the Deputy Governor of Elgeyo-Marakwet County, and have taken tough and innovative measures in the Elgeyo-Marakwet County, where it's mentioned that the 4 constituencies, Keyo South, Keyo North, Marakwet East and Marakwet West, these are some of the malaria-prone areas, but as the county government, already they've asked KEMSA to fast-track the supply of drugs in malaria-prone areas. Back to you in studio.
Thank you so much, Elvis.